If you're weighing your options to lose weight, there is still time to do that. And even if you've already made an attempt with surgery but it's failed, don't give up. There are solutions out there to get you back to a healthy you. Here to share answers on this is board-certified bariatric surgeon Dr. John Alexander from the Alexander Center for Obesity Surgery. Welcome, doctor.
Thank you.
Now, tell us, how has bariatric surgery changed over the years? I know it's been around for a long time, but it's very different now today.
Well, it's quite different because we all know a lot about bariatric surgery than we did a few years ago. There are multiple options available now. In a sense, it's getting very complicated, but on the other hand, we have a lot of good information. We allow a lot of new options and a lot of more effective options that's much more helpful now than we did years ago.
So if someone had surgery several years ago and maybe they weren't happy with the results or wanted to try something different, are there other options for them that you could provide?
Well, there are great options. There are multiple options, and most of the options are now safe than ever has been before, because one of the revolutionizing part of bariatric surgery is that these are all done with laparoscope, which is does not have any long incision or open the abdomen, and much safer, much less pain, and the result is by far superior than it was before.
Much nicer options then
Yes.
for the patients. And you have one of your patients here with us today, Anjie Coplin. Yes. Thanks for being here with us.
Thank you.
Your surgery was 10 years ago?
Yes.
And what have the benefits been for you?
Well, I think when I had my surgery, I was very shy, introverted. I had a lot of friends, but I lacked confidence. And when I had the surgery, people viewed me differently, and I expected that. But what I didn't expect, and was a nice surprise, is how I started to see myself. And my confidence grew, and I was able to do a lot of things that I thought I wasn't able to do when I was at my heaviest weight.
I think we have some before and after pictures. And that's great.
Wow.
So, or before pictures,
Yes.
your after picture. Wonderful. That's great. So, unexpected and expected results. And how much have you lost?
The last time I weighed myself, I don't weigh myself too often, but the last time I had lost 140.
Oh, wow. Congratulations.
So, yes, thank you.
Oh, wonderful. And Dr. Alexander, if there are other people out there who have had maybe a bad experience with it and their doctor's telling them there's nothing that they can do you have other options for them?
We do actually, because we opened a center for revision of bariatric procedures approximately 7 years ago.
Wow.
And it's been very successful, and 75% of what we do right now is basically correction of previous bariatric procedures.
Wow.
Individuals who had lap band did not work very well, we welcome them to come and see us. Individuals who had a gastric bypass, they regained their weight or they have a lot of problem with it, and we all go and correct them, and the result seems to be very, very good.
It's wonderful. It's really a
Yes.
great resource and helpful for many, I'm sure. Anjie, since you've had the surgery, have you missed the food and missed the lifestyle that you had before?
I certainly do not miss the lifestyle, but there are times, I was an emotional eater, so sometimes when I'm going through some emotions, the first thing that does pop in my head is food, but it's just a thought, and it's a passing thought. And I'm so thankful to Dr. Alexander. My life has changed greatly, and I have been able to do a lot of things that I thought I never could do, and so I would recommend this surgery for anybody who thinks that this is something that they want to do for themselves.
What are the things that you do now that you haven't done, we're not able to do before?
Well, I feel like I was a wallflower before. I kind of tried to blend in and stay behind, and once my confidence grew and the weight started to come off and I started to feel better about myself, I just became more outgoing and more social, and I started running and doing 5Ks and things that I just never even thought I would
now
ever
you're
do.
on TV.
Oh, and now I'm on that.
Yeah. What about insurance, Dr. Alexander? Is this something that would be covered by insurance?
Well, they're all covered by insurance.
Oh.
The interesting part of it is because the complication of the bariatric surgery or the failure of bariatric surgery most of the time causes symptoms that the patient makes people very sick. So by correcting the bariatric procedure, we'll correct all the symptoms, and that's one of the best things that we do actually for most of our patients. Bariatric procedure, once these procedures are done overall and when it requires revision, it really needs extra skill by the surgeon, and it's not a procedure that any surgeon should handle it. And one of the things that we are very proud in our center is that all what you do is correction of the previous bariatric procedures, and our goal is always one thing, to make sure the procedures we do is very safe for the patients.
Wonderful. Thank you so much for sharing this with us, Angie.
You're
Thank
very
you for
welcome.
sharing
Thank you.
your story. To learn more about sleeve gastrectomy or any other weight loss procedures, you can contact Dr. John Alexander at 972-247-7767. You can also meet Dr. Alexander and former Dallas Cowboys player Kevin Brooks at 7 p.m. tonight when they host a free seminar entitled Bariatric Journey to Better Health. It will be held in the Forest Park Medical Center Auditorium in Dallas. Reserve your seat online at gastricsleevedallas.com or call 972-247-7767.